Good morning. It is day 8. I want to start calling it something else other than just post-op day 8, whatever. This is, yesterday was a week since I had my surgery. So, I don't know what to call it. So, I guess it will just still be day 8 post-op. I don't know until I figure it out. So, day 8, the beginning of my surgery, or my journey, kind of slept okay last night. I didn't sleep really good last night. Man, I really wish I could sleep on my side, but propping pillows and get comfortable just does not do the job. And then, you know, we have cats and we have dogs, and they all want to, you know, sleep with you, or, you know, my cats, they love to sleep on your belly or on your side. Well, they can't do it right now. And, you know, I'm sitting here on the bed because I'm fixing to, you know, tell you all about the diets, you know, and things that you have to do before surgery and things you have to follow after surgery and everything else. So maybe this video can help somebody else. But my poor Oreo, she came to climb on me, and I said, I'm sorry, but Mama can't let you climb on her today. I said, because I had surgery and I hurt. And she's just looking at me like, what are you talking about, human? I don't understand a word you're saying. But then I, you know, raised my shirt and I showed her my my boo-boos, and she looked at it, and then she just turned and walked away like, whatever. So, you know, people think animals are stupid or whatever, but I think I have the smartest animals in the world. But anyways, all right. So, today, first of all, I'm going to start off with my vitamins that, you know, I had to start taking beforehand. I still can't find the sheet that shows which vitamins to buy. I know where it's at. Between here, the hospital, and everywhere else, it managed to get lost. But in the beginning, when I first started this journey in September, the doctor, or his assistant, rather yet, wanted me to start, or the dietitian, wanted me to start a 1-a-day multi-complete vitamin. And that was the Centrum Adult tablet, which is, you know, Centrum Adult tablet. I had to take one of those in the morning, and then at noon I had to take 2 of the Citracal Petites. And you know, they have to be the Citracal Petites. They can't be, I mean, you can get the Equate brand. I believe my last bottle of them I got from Walmart, and I believe that's where we get the Equate. It's Walmart. And it's the Petites, and they are so much smaller than the Citracal ones. But I was having to take 2 of those at noon, and then 2 of those at night. And this is, you know, from September until, well, I'm still having to take those, but not, you know, at noon. My whole diet thing is, or vitamin thing has changed, but all the way up until before surgery, that's how I was having to take those. But if you get the Equate brand of the Citracal Petites, it's comparable to Citracal. So, you know, you're okay there. And the doctors will tell you that, you know, it says compare. So, the Equate, like I said, the Citracals that I were taking, the pills were, I'm telling you, horse pills. They were huge. But, the Equate brand, they're actually like 1 pill cut in half, but they're way much better. So after my surgery, this is my just my vitamin regimen thing. For the first 6 weeks after surgery, I have to omit the calcium dose at 8 o'clock. So it says at 8 o'clock, I am to take 1 tablespoon Nature's Way liquid calcium or 2 Citracal Petites. So for the first 6 weeks, I can't take the 8 o'clock dose. So starting at 10 o'clock, I do my Flintstones Complete Chewable Tablet. No gummies. No gummies whatsoever on any of this. And 1 dose of the B50 complex and 500 milligram sublingual vitamin B12. Which the B12 goes under your tongue, and if you get it, it tastes like cherries. I mean, it's not bad at all. It tastes way better than the Flintstone chewable vitamins that I've been chewing. And then at 12, I have to do 1 tablespoon Nature's Way liquid calcium or 2 Citracal Petites. And then, again, I have to, at 3 o'clock, I have to do 1 Flintstone Complete Chewable Tablet. And then at 6 o'clock, I have to do 1 tablespoon Nature's Way liquid calcium or 2 Citracal Petites. And then, you know, after 6 weeks of surgery, at 8 o'clock, I'll do the 1 Centrum and the 1 dose of B50 and then the sublingual vitamin B12. And then 12 o'clock, 3 Citracal Petite tablets. And then at 3 o'clock, 1 Centrum adult tablet. And then 6 o'clock, the Citracal Petites again. So that's just the vitamins. And that's not including my everyday medicine that I have to take, which I take, you know, I take a pill for my anxiety. I take another one for my migraines. They took me off my blood pressure medicine. I'm not supposed to take it at all. And that was for my migraines. What else? Oh, and then I take a muscle relaxer because I have fibromyalgia, and between my anxiety medicine and the muscle relaxer, it's supposed to help me, which it doesn't. So, needless to say, you know, before you do the surgery, they have you do classes. You have to do a lifestyle change class, and you sign a contract with them, and you follow the lifestyle change class. It says choose well-balanced meals, lean protein, low-fat dairy, vegetables, fruits, whole grains, small amounts of heart-healthy oils. Plan meals in advance. No sweets, no fried foods. Avoid mindless snacking. Practice mindful eating. Lots of water. 64 ounces of water per day. Beverage guidelines. No sodas, no juice, alcohol, sweet tea, etc. Exercise at least 1 hour each day. Cardio exercise 5 to 6 days each week. Exercising in the pool, dancing or using a treadmill, exercise bike or elliptical. Exercise is vital to losing weight after surgery. I understand that. But, like myself, the surgeon says, since I have the bad knees and it hurts to walk long distances or, you know, be on my knees since I'm overweight, until I lose the weight, I have to walk 15 minutes so many times a day. You know, I have to space it out so many times a day. That way I'm not hurting myself more. Do the vitamins. Like I said, it's 1 complete multivitamin mineral supplement once daily. And it says such as 1 Centrum adult tablet and 1 calcium with vitamin D 1 to 2 times each day, such as 2 Citracal Petites twice each day. And then it says, it'll give you potential side effects, expectations, which you'll have vitamin and mineral deficiency, temporary hair loss, excess skin, worsening depression, inability to tolerate certain foods, nausea, vomiting, gastroesophageal reflux, GERD. And then, outline of appointments. You'll have a new patient appointment, a nutrition evaluation, a medical supervised weight loss visit, which I had to do 6 of those, pre-op nutrition class, pre-op visit before surgery, pre-op office visit 2 weeks after surgery, pre-op nutrition class 5 to 6 weeks after surgery, clinic visit every 3 months for first year after surgery, clinic visit every 6 months between years 1 and 2 after surgery, and lifelong follow-ups, which I'm okay with that. Outline of diet stages. 2 weeks before surgery, pre-op diet. The night before morning of surgery, immediately after surgery, stage 1, stage 2, and stage 3 diets. And I will be going over stage, I will be going over chapter 1, pre-hospitalization, which is pre-op, before surgery diet and all. It says pre-hospitalization instructions. 2 to 3 weeks before your surgery date, attend morning of preoperative classes. Uh-oh. My phone is dying. My phone is dying. I'm sorry. Hold on just a second. I'll get this doodad plugged in. There we go. Okie dokie. And then it says, the week before surgery. Okay, now over here to where we do the diet. Preoperative diet. This is the fun part. Oh. Preoperative diet is designed to shrink your liver before surgery and help reduce surgical complications. I'm sorry, I cannot talk this morning. Require that you follow this diet for 2 weeks, 14 days prior to surgery. Not following the pre-op diet may result in surgery cancellation or surgical complication, or i.e. increased surgery time and open procedure when a laparoscopic procedure was planned, injury to the liver, leak, etc. For your safety during surgery, please follow the exact as written. What to expect. The first 2 to 3 days are usually the most difficult. After this time, the pre-op diet generally becomes easier to follow. During the 2-week pre-op diet, you may experience hunger, fatigue, headache, dry mouth, bad breath, constipation, or diarrhea. For suggested ways to alleviate some of these symptoms, see pre-op problem solving on page 21. Follow the guidelines exactly as written will also help to reduce some symptoms if at any point the pre-op diet becomes too difficult to follow. Please contact the bariatric team for further guidance and support. Patients with diabetes. The pre-op diet is very low carbonates. If you take oral diabetes medicine or insulin, you must contact your prescribing physician prior to starting the pre-op diet. They may need to adjust your medication according to avoid hypoglycemia, which is low blood sugar. May not have any solid food starting 2 days before surgery. Each day choose either all liquids or liquids and 1 solid meal. It says pre-op diet. All liquids, you drink 3 to 4 protein drinks per day, at least 3 cups, 24 ounces per day, which of calorie-free beverages. A solid food meal on none, free foods none. Or you could have liquids plus solid meal, no solid foods starting 2 days prior to surgery. So with this one, if you do the protein drinks, you have 2 to 3 protein drinks per day, at least 3 cups, which is 24 ounces of water per day, or calorie-free beverage, 1 serving of lean meat, 20 grams of protein, 1 serving of vegetables per day, and then your free foods as desired in moderation. Okay, now I'm going to tell you. These are the things that the protein drinks. The protein drinks I got the Premier Protein you get at Sam's or Walmart, and they're 11 ounce containers. Where's my protein drink? This is what I drink. This is my breakfast. I've been slowly sipping on it, and hopefully I'll have it gone by noon. This is my goal today, is to get 2 of these suckers down. My goal. But I was told yesterday by the doctor's office and my nurse case manager with our insurance that I need to get more water down me than I do the protein drinks. So I plan on doing both. So that's my goal. It says guidelines for choosing protein drinks. 20 to 30 grams of protein per serving, no more than 100 grams of carbohydrate per serving, or 10 grams of carbohydrates per serving, no more than 2 grams of sugar per serving, no more than 3 grams of fat per serving. So I'm going to try to take pictures of these and have my kid help me make a video of the pictures. That way you can see what they look like. Add-ins may be added to liquid or powdered protein drinks. Add-ins must be 10 calories or less per serving. Coffee, espresso, unsweetened, brewed, or instant, caffeine-free after surgery. Water flavoring enhancers such as Mio or Dasani drops. Drink mix, sugar-free, like Wyler's or Propel. I've been using the Wyler's. I like the lemonade, which you can see right there is in my cup. Imitation vanilla extract. I don't care for vanilla. Flavored syrup, sugar-free, like Torani and Da Vinci. I've never heard of those. So, ice, sugar substitute, stevia, sweet and low, Splenda, Truvia. And then it says at the bottom, it says, note, you may freeze any liquid protein drink or recipe. These may be eaten like a popsicle or ice crystals can be scraped with a fork and eaten. So, yeah, I liked mine when it was really, really cold. It was like, because I like when I get my milk, or when I drink milk, or if I drink chocolate milk or whatever, I'll put ice in my milk. And it just makes it really, really cold. And that's how I like my milk. And then it gives you protein drink recipes, which I didn't get the powder because I was afraid of powder. But my husband got the powder and he kind of liked it. But he's a weirdo anyways. They even have chicken soup powder. I don't know. That's crazy. But anyways. Solid meal. Here is what you could have. It says you may choose 1 serving from each category. 3 ounces of grilled or baked lean meat without condiments, sauce, or gravy may be substituted for one of the protein drinks each day from days 1 to 12. If a food is not on the list, you may not have it. No fruit, no juice, no bread, no pasta, no rice, no cereal, no grains, no beans, no peas, no corn, and no potatoes. Foods may be sautéed using oil, butter, substitute from Free Foods on page 18, or optional item. Baked, broiled, grilled, boiled, poached, roasted, or steamed. So your lean protein must be at least 90% lean, 10% fat or less than 3 grams of fat per ounce. One serving equals 3 ounces cooked, about the size of a deck of cards. So what I did, I went and got me a scale, and I cooked vegetables and meat, and I cleared out, I put a container down, I cleared out my scale, and I put my meat on it. I measured out 3 ounces. That's how I done that. And then when it came to my vegetables, I used a measuring cup, because I'll get to the vegetables in just a second. Let's do the protein. You can have beef, which is flank, ground, loin, sirloin, tenderloin, or round. Chicken, ground, skinless breast, or canned in water. Deli meat, you could have chicken, ham, turkey pastrami, roast beef. Fish, you could have fresh, frozen, or canned in water. Pork, ground, loin, tenderloin, ham, or Canadian bacon. Shellfish, clams, crab, lobster, oyster, scallop, and shrimp. Tofu, light. Turkey, ground, skinless breast. 6 egg whites or 3/4 cup egg substitute. And then now we're going over to the non-starchy vegetables, fresh or frozen or canned. 1 serving, 1 cup cooked or 2 cups raw. This is what you could have. You could either have the 1 cup cooked vegetables, or you could have the 1 cup raw. You could have artichoke, asparagus, beets, broccoli, Brussels sprouts, cabbage, carrots, cauliflower, celery, cucumbers, eggplant, green beans, greens, lettuce, mushrooms, okra, onions, peppers, all kinds of peppers, radishes, sauerkraut, sprouts, alfalfa and bean, etc., and water chestnuts. And your optional, if desired, may have one serving. Serving sizes are listed. 1 teaspoon canola, olive, or peanut oil. 1 tablespoon light butter or light margarine, trans fat-free versions. 1 tablespoon reduced fat mayonnaise. 2 tablespoons reduced fat salad dressing or marinade. So that's what you could have on that. And then it gives you recipes like frittatas and stuff. And then we go over here to your free foods. You may choose these foods in moderation. Seasonings: garlic, herbs, fresh or dried, horseradish, lemon juice, lime juice. Spices that do not have added sugar. Condiments: hot sauce, Tabasco, Frank's Red Hot Sauce. Mustard, soy sauce, vinegar, Walden Farms calorie-free dressing, Worcestershire sauce. I can say Worcestershire. Oil and butter substitutes. Butter spray, 0 calories. Like, I can't believe it's not butter. Non-stick spray like Pam. Sugar substitutes. Splenda, Sweet and Low, Truvia, Stevia. Low-calorie foods. Broth or bouillon, 10 calories or less. Gelatin, Jell-O, sugar-free, 10 calories or less. And I'm telling you right now, the best Jell-O is the cherry flavor. And the strawberry flavor isn't bad, but the orange I really do not like. This is before surgery, so you could have gum, which is sugar-free, and I'm forgetting the kind that Joe got me, but it's like Mentos, I believe it is, and it's expensive, but it's good. You could have ice popsicles, sugar-free, 10 calories or less. Pickles. I think I killed myself on pickles, because every day I would get hungry and I would have a pickle. So he got me pickles. Pickles, dill pickle relish, or no sugar added bread and butter pickles, which those are the bomb. Believe me, they still taste like bread and butter pickles. May not have starting 2 days before surgery. I wish I could have a pickle right now, because I've been craving one of those bad boys. Other beverages. When to begin, you want to start following these beverage guidelines 2 weeks prior to your surgery. In preparation for surgery, we expect you to choose only calorie-free, non-carbonated beverages from the time you begin the pre-op diet and continue this habit for the rest of your life. Calorie-free beverages must meet the following guidelines: no carbonation, no sugar, 5 calories or less per 1 cup, which is 8 ounces. Caffeinated drinks are not recommended for 6 weeks after surgery. Alright, it says suggested calorie-free beverages are Aquafina flavor splash, fat-free broth or bouillon, coffee unsweetened, hot or cold, Dasani flavors, Crystal Light Pure with Truvia, Fruit 2O, not sparkling, Hint, fruit-infused water, Lipton bottled tea, diet, Powerade Zero, which I have some of that, and I'm not big on the blue ones, but that's what my husband got me, is the blue, and it tasted okay. Let's see, I already said that one. Propel Zero, Snapple Diet, tea, unsweetened, hot or iced, which, this is pre-op, so I'm guessing the caffeinated doesn't matter right now, but after surgery, you can't have caffeinated. Vitamin Water Zero, water, any beverage meeting the above guidelines. Suggested beverage add-ins to add flavor, you may use creamer, plain, non-fat, non-dairy powder, limit 2 teaspoons per day. Flavored syrups, sugar-free, Torani and Da Vinci, I still have not heard of those. Lemon or lime wedges or 1 orange wedge per 8 ounces of water, limited amounts allowed. Mio drops, Dasani drops, and Weiler's Light low calorie drink mix. And that's what I have, is the Weiler's low calorie drink mixes, because I like the lemonade, like I said. But no alcohol. Let's see. And I believe that is it for the pre-op. Yep, that's it for pre-op. Two days before surgery, no solid foods. You cannot have no solid foods. It's just drinks. And then the night before surgery, it says nothing to eat or drink after 10 p.m. night prior to surgery. Well, that's the wrap up on that one. I am going to do a different video for the like the day of surgery and the hospital stay and all of that. I'm gonna sit here and try to drink some of my protein drink, and then I will be back with another video on the other part. These are the things that I told you in the beginning that I would do and I didn't do. So I'm getting those done today. Anyways, thank you guys for watching. I hope this helps somebody. I hope it gives you understanding. I mean, I know there's many places doing these surgeries, and I know there's a lot of different information being given out and everything, and I know it can be a scary situation and you don't know what to do. I mean, you know, I've been trying to get this surgery, or thinking of this surgery, you know, for the past couple years. I mean, I've been so overweight. I've just been too chicken to do it. And then, you know, the more I have knee issues and back issues and everything, you know, that's when I started really getting down on myself. And like, you know, I've dieted and I've lost the weight. I mean, I've lost the weight and then I've put it back on. I've went to a weight doctor. I've lost the weight and I've put it back on. I mean, sometimes it's just so hard for somebody to simply just lose the weight and keep it off. And surgery is, you know, one of those last resorts that some of us can do. I mean, some of us just wasn't born with the perfect metabolism. I mean, or, you know, in my case, I started gaining weight because of hormones and steroids. But anyways, you know, I had my surgery here in Temple at Scott and White. And they took really good care of me. I loved my surgeon. He's really cool. I mean, I think he'd done such an awesome job. And, you know, the information they gave me in this packet has really helped me. I mean, I've read this book like, I don't know how many times. And even now, after I have read it so many times, I still refer back to it. Because, man, I just really need to go over that again. You know, so, if you have, like I said, if you have any questions, I mean, you know, feel free to message me on Facebook. Like I said, my name's Tabitha Loeffler on Facebook. I still got to write my other email down, because if I give you my my regular email, which is my joint email with my husband, you might get lost somewhere in there and I won't find you. But I have a an email that goes with my it's supposed to be my daily Bible verse page. And I kind of, you know, you start something and you don't follow through. Yeah, that was me. That's one of the things I need to get back with. But it goes to that page. It's on Facebook as well. But it's email address that goes to that page. I'll have to get it for you. But in my next video, I'll try to have it wrote down. That way I can tell you what. That way you can email me. And if I can take pictures of, you know, these pages and send them to you if, you know, that's something that you need or would like to read over or whatever. But like I said, I'm going to try to take pictures of these and make a video. That way, you know, you can see what I've, you know, done. But anyways, I'm going to hop off here. I'm going to drink my protein drink and drink some water. And then I'm going to come back and do stage 1 diet. I will see y'all in a little bit. God bless.